Hello, everybody, and welcome back to the Love Your Dogs podcast. This podcast is heart led, real life, experience based, and sometimes a pinch of dry science. And today I know we're going to get into some science. My name is Bree Drake. I am a holistic dog health educator and a certified holistic pet health coach. And today we have an incredible guest. Her name is Dr. Kendra Pope. She is an integrative veterinary oncologist. And I could go on and on about all of her obvious credentials, but to me, she is a very unique and powerful and necessary voice in veterinary medicine. She's just brilliant when it comes to bridging the communication gap between conventional medicine and holistic medicine, something I'm facing all the time in what I do. So I just adore everything that she's doing. And thank you for being here. And can I address you as Kendra, or do you want me to call you
Sure.
Dr. Pope?
Yeah,
Okay. Okay.
sure.
I meant
Absolutely.
to clear that up before we started talking. So
Yeah. Yeah. Thank you,
yeah,
Bree.
so welcome. Thank you so much. Oh my gosh. And if you want, I mean, I know every time this question comes up to me, I'm like, oh boy, I got to go into my heartbreaking story of why I'm doing this. But if you want to go ahead and let it in as much detail or as little detail as you want, let the audience know why you do what you do, how you arrived at wanting to be a veterinary oncologist, specifically integrative and holistic veterinary oncology.
Yeah. And
Yeah.
isn't that always the case, right? It's a heartbreak. Your pain becomes your purpose.
Yeah.
So many people that find this path, this type of medicine, it always comes from something painful. And my story is no different. I lost my father at 22 to cancer, and it was a very quick experience. He was diagnosed in March and he died on Christmas Eve the same year. And I watched conventional medicine fail him. And we expected that. They told us it would fail him. And I watched him suffer through it. So not only did it not do anything, it just made his quality of life suck the whole time. And so I knew that when I went to vet school, because I had always wanted to be a vet, so that didn't change anything, that I wanted to be an oncologist because I needed to understand what had happened and I needed to help people who were going through the same thing I was going through. But when I got to vet school, I got exposed to these different types of tools in the toolbox really early, acupuncture and herbs and physical rehab to start. And I was like, hold on here. Like, if my dad had had access to this type of stuff, wouldn't his quality of life have been better? And if his quality of life had been better, could he have lived longer? And so all these little things just started happening in my life where I just started falling down the rabbit hole and having all these aha moments. And as I went further and further in my conventional education and learned everything that there was about cancer and got to like the top of the top of the top of when you're studying for boards and you're supposed to know everything there is to know, I was like, wait a minute, there's still so much more to know. And there's still so many more questions that I don't have answers to. Why is no one asking why we're getting cancer? Why aren't we learning about why our animals and our people are getting cancer? And so I just feel really grateful that all of those things happen to me, like so many of us do, because then it becomes our mission and our drive and our purpose and all of those things that just make us keep like pushing forward and asking those questions. And so although I did practice conventional oncology and I did administer chemotherapy for a period of time, I quickly learned that where my impact was meant to be and where I'm supposed to make a difference is not just helping pets with cancer with different tools, but really where the big changes is teaching pet parents how to prevent it from happening in the first place. Because here's the big lie that we've all been sold, that cancer is just bad luck and there's nothing we can do about it. And that's so not true. And so what I realized is that, hold on, there's all of these lifestyle factors that we have control of, both as pet owners and as humans, that we can make choices to prevent or lower our risk of cancer. And so that awakening is what kind of have has led all of my professional decisions since then.
Yeah. And similar, but very different. That's kind of where I'm at. I mean, I didn't even go to veterinary school, and here I am. I wanted to be a vet when I was a little girl. I actually grew up in Florida. So
Oh,
hearing
yeah.
about you going to UF, I'm
Yeah.
like, "Oh, that was almost my path."
Yeah.
And I went a completely different direction. And lo and behold, ended up right back where I wanted to be since I was a little girl, helping people with their dogs. And I'm trying to remember here what I wanted to back up to. So so you went to UF, and I think what a lot of people fail to realize is that our holistic, our integrative, our homeopathic veterinarians, they all go to the same traditional schooling
Yep.
first. So
Yep.
you're not just some woo-woo witch doctor who's
Nope.
out here just throwing herbs at everything, and
Yep.
you have the conventional training. So I like to point that piece out. And similar to you, I've lost a lot of humans in my life to cancer. I've seen what happens when fear takes over and they
Yes.
just go the conventional route. I see
Yes.
the quick deterioration, putting families through the ringer. I mean, it's just awful. And
Yeah.
then it happened to my dogs, and
Mm.
it happened to both of my dogs a couple of years ago, which everyone here knows my story. But I had a 12-and-a-half-year-old golden who had oral cancer. So that was a very slow, fully holistically supported process, no surgery, no chemo, no radiation. And our younger golden was 8.5. Never expected that he was going to be sick, especially not diagnosed 2 months after our older golden with
Wow.
hemangiosarcoma. Lost
Yeah.
him in 6 weeks. He died in my arms after chasing a ball one day, the classic horrible story.
Yeah.
So that's I relate so much to you and how when that happens, I simply couldn't accept it as this was just bad luck. And I know
Absolutely.
so many humans and so many dog parents accept it this way. And I guess maybe it's a comfort thing. Not entirely sure. But to me, that's just was never going to be the case. I knew I had to do some digging. And oh my gosh, the more I learned, the more I just felt so betrayed by what
Yes.
we were told was good dog parenting. So I guess where we should take this next is why are so many dogs getting cancer?
Yeah.
Based on your opinion, your expertise, your research, why
Yeah.
is it happening?
Yeah. And I
Yeah.
think that this is important to talk about because there's a lot of data that we don't have. And I really want to share with pet owners the reality of the situation. So, the first thing that I want pet owners to know is that in people, cancer is what's called a reportable disease, meaning that if you or yourself or a family member or a loved one were diagnosed with any type of cancer, it would be reported to an agency to keep track of. How old are you? Where do you live? What type of cancer is it? And any other types of details that are relevant so that we can keep track of that, right? So that we can keep really good data and information so that we can see if things are changing. Are cancers skyrocketing? What kinds of cancers are skyrocketing? Are there pockets of places where cancers are going really high? Those are all really important, right? And those are public disease and public health concerns. But here's the thing. Cancer is not a reportable disease for animals. When I diagnose an animal with cancer, when my colleagues diagnose an animal with cancer, we don't report it anywhere. And so there are no agencies that are tracking this information. And so back in 2022, which now, at the time that we're having this conversation was already 4 years ago, a pet owner got wind of this and donated some money and did a big survey. And what they found out that we always believed to be true, which was that animal cancers and human cancers pretty much track the same. The increases kind of are the same. We live in the same environment, we get the same types of cancers, they're the same. What they found out was that that was not true at all. That actually dogs were getting cancers at a rate 5 times higher than people. And since that survey study was done, there's been no follow up studies. So, to be completely honest with you, we're just guessing at how bad this is.
Yeah.
But what I can tell you is that there is a crisis in people. And if people have been watching the news at all or following it all, what is going on the human side with cancer is that cancer is increasing significantly, but it's not in the typical population of people that we think. Usually, people over 68 and seniors. It's happening in people under 50 years old. The average age of the person diagnosed with cancer today is 48 years old. And what they're finding is that over the last 2 decades, really, is that there's been this huge shift in cancers of people older to cancers who are younger. And what they've found in the studies that they're done, they are absolutely due to environmental causes. And the ones that they are causing out the most are seed oils, diet, microbiome disruptions, and then stress and basically toxic exposures. And so all of the things that have happened to our environment to increase convenience, to poison our food systems, to poison our farms, all of those things are having catastrophic effects on the human population. Now, all of those things that we're doing to our human health system, we've been doing to animals for many, many decades, and we do it way worse. They get way more exposures to pesticides, way more exposures to processed food, way more exposures to chemicals, way more vaccine exposures, way more pesticide exposures, all of those things.
Can we
And
talk about why it impacts them so much, like, worse? I mean, their lifespans are already so short, so everything is just happening at an exponentially faster rate, right?
absolutely. Yeah,
Yeah.
so their lifespan are obviously much smaller than ours. Their metabolic systems are heightened and much faster than ours, but also they have different sensitivities to things, right? So their detoxification mechanisms are slightly different. Their ability to absorb things and metabolize things and smell things are different from ours, but their exposures are also much greater. The other thing about dogs and cats that I don't think we think about as much with cancer that we probably should is when we think about humans over time, we've quote unquote bred with lots of different people, right? From all different parts of the world, all different races, all different things. And so we have a lot of what's called like genetic diversity. Whereas when we think about like our amazing dog breeds that we love so much, like our Goldens and like our Labs and like our Shepherds and all of our other breeds that we love, they're what we consider inbred, right? And so what that does is it takes this gene pool and instead of kind of making it stronger by breeding with lots of different people, it's made it a little bit weaker. And so what it actually does is it makes them more sensitive to anything, to our environmental factors. So, this myth about cancer being genetic, it absolutely has a genetic component. But whether those cancer genes turn on or off is based on what's happening in the environment. So if we're a purebred dog or a modern day dog where our genes are already a little sensitive, you put a little bit too many chemicals and they're already all over the place signaling for cancer.
Yeah, I
So,
think that's why for
yeah.
me, to some people, what I'm doing seems extreme. I'm as minimal vaccines as possible, none, or raw feeding, no flea and tick meds. I am on the extreme side because I have a really sensitive breed. I've got another golden retriever who's almost 2 years old and doing really great. But it's important to know your breed well because you're not going to have a lot of give if you're already starting out with these predisposed breeds. And I'm glad you brought up the genetics because I was just looking into that so much more. How they just I was trying to look up an analogy. I think it went something like the they have less tools in their genetic toolbox. Like, they're
Mhm.
just the diversity makes them have less tools or less mugshots for what they might experience or not recognizing as many things they're gonna experience because it's just been so, is diluted the right word?
Yeah, yeah, absolutely.
Yeah,
Yeah, and not
yeah.
strengthened. And there's this quote that I always share with my pet owners that I feel like kind of helps you to picture how genes and environment kind of have this dance and this relationship. And it's that your genetics loads the gun, but your environment pulls the trigger. And so, you can genetically be a mess. And if you live in this pristine environment that you're talking about, right, where you're minimizing toxins and you're minimizing stress and you're supporting gut health and all those other things, then that's okay if your genes are a little messy because you don't have to worry about them being stressed. But in the end, consequently, people always give me the example, well, how does the little old lady who smokes her whole life never get cancer? Well, because
Yeah.
she had really strong genes, right?
Mhm.
You put that same little old lady with the crappy genes in that environment, she will get cancer. And so it's a dynamic interplay between the two. And I think being overly cautious when exactly what you're saying, when there are high risks present, is not extreme. It's just
Yeah.
smart. And it's also reasonable based on what you're exactly saying.
Thank you. Yeah, and that paints another good picture. Your smoking example, I always try to tell people I'll focus heavily on a lot of different topics and a lot of things, but it's never just one thing.
Absolutely.
It's a cumulative load. Everything kind of compiles. So, yeah, that woman smoking her whole life may have been doing a lot of other things, right, to offset it. Maybe she was moving a lot. Maybe she had no stress at all. I mean, the smoking indicates she was probably a little stressed. But and then, too, me being extreme or smart. Sometimes I think people get so terrified of cancer that they're doing all of these things in a stressful, anxious, anxiety ridden manner. I think stress plays a really big role in cancer as well. So, what are your thoughts on cumulative load? And I guess what I would say is if you brought a new puppy into this world, what would you focus on the most?
Yeah, absolutely. And this is where, the way that we've been conditioned to think about health can really interfere with what I'm about to say and can feel strange to people. Because when we think about why we go to the doctor, we don't go to the doctor to say, "Hey, I feel really great. What can I do to stay feeling really great?" Nobody does that. We're not taught to do that. And frankly, if you go to your doctor and say that, they'll be like, "Why are you here? Leave." Right? Because our conventional medical system, whether we are a human doctor or a veterinary doctor, we are not taught in medical school to maintain health. Preventative disease for us as veterinarians is about vaccination protocols and spaying and neutering, which now there is lots of evidence to show that these practices are actually harmful and that actually we should consider changing what we thought was this gold standard and maybe consider different things. And so, what I would suggest pet owners start to do is think about the narrative of health, right? And that our conventional system has conditioned us that we only seek the doctor when there is something wrong. But here's the huge problem with that. By the time something is wrong that you are appreciating for yourself or for your pet, shit's been going wrong for a really long time. And when we're talking about cancer, there are scientific studies that have shown for people 10, 15, 25 years for that cancer to be have developed that you're finding today that you think popped up overnight. And for dogs, it could be 5 to 10 years that the cancer that was diagnosed today that you didn't think was there has actually been developing. But here's how that's possible. Because our conventional diagnostics that we have, blood work, chest x-rays, ultrasounds, they can only detect cancer once there's a billion cancer cells present. We need a billion cancer cells to have this tiny little centimeter mass that we can see on our imaging diagnostics. But that can take years and years and years and years. So here's the thing. Stuff has been going wrong for many, many years that is creating this garden for this weed to grow in. And because it's gone undetected and flied under the radar, it's become an environment that's made that weed stronger and stronger. And so, what we need to think about is wow, this isn't scary. This is such an opportunity. We have so much time to make choices like you're talking about every day that are going to compound over time that will allow me to create an environment that is hospitable for that weed, that weed does not want to grow in, and that can maintain health. But that isn't something that we can frantically do when we find out about a cancer diagnosis. That is something that we should be doing every day. And so, this type of way about thinking about health can feel really unusual. People can get really overwhelmed because they don't know where to start. They maybe feel like it's too expensive, right? Because we're not used to investing money in this. We're only used to paying insurance when we're sick, right? So this is something where we need a bit of a paradigm shift. But the good news here is, hey, you have 5, 10 years to do this. So let's do a little bit at a time. So to answer your question, how do I feel about the cumulative benefits? That's where all the power is. That's where you have control. And that is where you prevent ending up at the doctor's office feeling like you've been blindsided with a cancer diagnosis.
Yeah, that's something I really wanted to touch on too. There's so much cancer detection is labeled as prevention. And it's like
Yes,
you don't wait until the blood work is telling you there might be something wrong or the ultrasound.
absolutely.
You start now, no matter what, especially if you have a cancer prone breed, you have to start right away. And I know firsthand, I mean, I had with my two guys, they were conventionally raised their whole lives up until about the last year. The last year, I started changing the food, stopped the preventative, stopped the vaccines, cleaned up as much as I could in the home and in the yard. and they still ended up with cancer. I mean, they were 11 years old and 7 years old when I swapped everything. So that just goes to show it takes a long time to undo that damage. I mean,
Yes.
they were full pull. I mean, I was at the vet every year getting the vaccines because I needed
Yep.
the up-to-date vaccines to get the preventatives, and they were on the same exact kibble their entire lives. I The vet told me not to give people food, so I didn't do that. I mean, the poor things just had no fresh food, terrible tap water. I mean, it was just it's amazing they survived as long as they did now knowing
Yeah.
everything that I know. Dogs are so resilient, and that's
Yes.
another thing that breaks my heart for them is so many people are like, "Oh, my dog lived to 15 and 16, and I did all those things." Just imagine what they've had to tolerate, you
Yeah.
know?
Yeah, and
Oh,
imagine how much time we could have with them if we had. And that's what I always think about with my guy. I was very lucky I had a dog that lived a very long time too, but the first half of his life I didn't know anything that I knew now. And so I always think about that. How much more time could I have had with him if I did know all of that from the beginning?
I know, and,
Mhm.
so here's something else I've been seeing a lot in the conventional space, and we kinda touched on this already, where a lot of conventional veterinarians will consider cancer bad luck, and they also are saying that cancer is more common because we have better diagnostic tools
Mhm.
and that dogs are living longer than ever. What are your thoughts on that?
Mhm.
It blows my mind that
Yeah.
that's like a comfortable space, a
A
comfortable
comfortable
reality for
answer.
them. Yeah.
Mhm.
Yeah.
Exactly. And yeah, I wanna go back to your comment about how where what we call early detection prevention. And it is a really important point to distinguish because you're absolutely right. There's these two things. One is called primary prevention and one is called secondary prevention. And primary prevention is what you're saying. It's actually doing things to prevent the disease from ever happening, right? Secondary prevention is detecting a disease early so that we hope we can catch it earlier. It's more treatable, it's more curable. We don't end up with it being a terminal disease. That is detecting it after it is already there. So you're absolutely right. There are two different types of approaches for that. If you are just trying to detect a disease early, you're just trying to detect a disease early. You're not trying to prevent it from happening. So there are very different protocols and strategies about what you're going to do one versus the other. When we hear these comments about how dogs are getting more cancer because we're detecting it earlier and they're living longer, I have absolutely seen those too. But here is the unfortunate reality: prove it. We don't have the data. We're not following the incident and the prevalence rates of dogs and cats in the United States because it's not a reportable disease. And so we don't know that these things are true. We just assume that the same things that are happening in people are happening in animals. And if we're going to do that, then we need to do that now, which is that it is exploding in younger populations because of the environmental choices that we're making, namely our dietary choices and our heavily processed diets. And so, if we're going to call that out in humans, then we need to call that out in our pet population too and say that that's a problem, which the industry and the profession has not. And so, although do we have better diagnostics to diagnose more cancers? Yes. Are dogs generally living longer? Some people would argue that's not true. Some people would argue that they should be living longer than they are and that they actually are living shorter periods of time. And so I think that it is a bit of a messy area because we don't do as much data collection as we probably should be doing to really understand the pulse of this epidemic.
Right. Yeah, and I mean, when I see those comments, I'm like, I deal with hundreds of dog parents on a weekly basis, and I'm seeing dogs as young as 10 months old with hemangiosarcoma and 3 years
Absolutely.
old, 4 years old, 5 years old. It seems to be so much more common in younger dogs. Is that what you're seeing too? Like, it's just happening
Yeah. And
earlier and
I,
earlier?
I agree with you. I've seen you said 10 months old. I saw a puppy that was like, he was like, oh my God, 4 months old, and he had a horrible tumor. And so here's the other thing that really I didn't understand for a long time. And it took me a lot of time in my journey of learning about integrative and functional health to make this make sense to me. I could never understand why children got cancer. I was like, hold on. Like, if this is an environmental disease and they're not just born with it, how do children get cancer? And the same thing, how do puppies get cancer, right? How is this happening? But then once you learn that your epigenetics, which is the signals that your environment gives to your genes to either turn on or turn off, actually are inherited from your ancestors and are actually affected by your mother and her womb, then you understand how children and puppies can get cancer. Because unfortunately, it's not even just what you do in this environment, in this life, but what happens in your fetal exposures and what your ancestors do. And that's not woo woo stuff. They've done scientific studies that
Yeah.
show that it's called your epigenetic inheritance goes back 8 generations. And so it's the environment, not just of you currently, but of your ancestors that are affecting your health today. And so it's much more complicated than better diagnostics and we're living longer.
Yeah, and much more complicated than just genetics from, like, a DNA perspective. It's
Absolutely.
environmental, toxins being passed down or stress,
Yes.
or that's why, how familiar are you with natural rearing breeders? And what are your
So I always like keep my eyes and ears for
Yeah,
them
yeah,
because I am always so happy to learn of them because to reinstitute those types of practices are only going to help the health and longevity of the puppies. And so there's not as many as I would like for there to be.
yeah. No, they're amazing. I actually got my dog from one, and the work that they're doing, especially from, not only from minimal toxic load on the parents and then the puppies, but the work that they're doing to identify that exact window when maternal antibodies wear off to then vaccinate only once is just incredible. And then, obviously the homeopathic no-sode route too. Just amazing stuff that I
It
I
is.
really am passionate about helping more people know exist because it can make such a huge difference, especially in
Totally.
sensitive breeds.
So much of the vaccine controversy around children and the human space, when you really distill it down to the biological and the medical problem that we think is really linked to so many of these issues is methylation problems. And methylation is basically the ability to detoxify. And we know that in people there's a high risk of people having methylation issues. It's a very common thing that can happen, and we know that it happens in dogs and cats too. We just don't know at what rate because it's not something that we're looking at. It's not something we're testing for. And so there's no reason for us to not assume that in our animals, they also can have these risks of inability to detox and have challenges doing so that make them higher risk to these things like we're talking about, like environmental toxins, vaccinations, all those types of things.
Yeah, for sure.
Hmm.
Gosh, there's there's so much, and it's so overwhelming, I know, for people hearing it for the first time, but if you just strip things down to the basics and take it one day at a time, you can really learn how to give your dog a better outcome and a better quality of life, if anything, even if cancer does ultimately arise someday. Um, yeah, let's see. Let's shift gears, and I remember back to when our older golden Anne, she was having arthritis issues, and I started seeing a conventional doctor who was also trained in traditional Chinese veterinary medicine, and she was performing acupuncture. And she talked me into switching to fresh food feeding and changed everything. My dog Anne, she was a new dog, like a puppy again. Great mobility, great coat, skin, everything improved. And it was that same vet who confirmed that what I'd seen at the base of my dog's tongue was cancer.
Uh,
And as much as she had more tools in her toolbox, she still
yeah.
told me that if you don't do chemo or radiation or surgery, your list of options is really small.
Hmm.
And that terrified me.
Yeah.
But I quickly learned that that list of options is not small. There are so many ways we can support our dogs. So, what do your integrative approaches look like
Yeah.
for dogs with cancer? What are the options that people have in different scenarios?
Yeah.
Yeah.
There is a huge toolbox. And one thing that I always talk with my pet owners about when we're doing a consultation or when I'm speaking or teaching with my veterinarians who I show how to do this approach that I talk about is that we have to start to shift the paradigm and our thought around cancer. There's this common theme that has kind of been perpetuated since like the 70s about waging a war on cancer, right? We're taught to have warfare, to burn and poison it, to cut it out, to do all of these things to remove the enemy. But we have to remember that cancer cells are not outside invaders that have come in. They are the body's own cells that, because of the environment, have gone really array and are out of control. And so, if you strategically identify what those things were that caused them to happen in the first place, the body has innate healing capacities to control cancer. It does it every day. There are cancer cells in everybody's body all the time, but we have sophisticated mechanisms within inside of us and within inside of our pets where they destroy them. If you get a sunburn, there's cancer cells forming, but your body knows how to handle that. If you breathe in pollution, there's cancer cells forming, but your body knows how to handle that because the environment is constantly assaulting our cells. And so it's developed ways to protect it. But when there has been too much chronic stress for too long, when there's been too much processed diet for too long, when there's been too many toxic exposures for too long, then those mechanisms that live become weakened and they can't do their job. And that's when overt disease, chronic conditions, and cancers can happen. So if you are in a situation where you can start to unravel that story, and figure out what those drivers are and start to correct them, you can over time re-strengthen that immune system that already knows what to do. And sometimes it can either stabilize the cancers or reverse them. Now, the challenging part is that oftentimes cancers aren't found until they're much later or pets are really sick. And so in those instances, thinking that we have enough time to do that is not realistic. But in cases where maybe we catch a cancer early, or maybe we have something like surgery that can help us to decrease the amount of cancer that we have, then we are in a better situation where our tools that are outside of the conventional toolbox can be used. And so, what do they look like? Well, they always involve diet. Because that is the foundation of everything. The more and more we learn about our gut, the more and more we know it controls everything. And that's not just including the immune system, that's everything. So it always involves diet. It always involves some degree of supplements or minerals or nutrients. It can involve immune therapies, whether they are simple tasks and simple things that we do to more advanced things like medical ozone, IV nutrient therapy, things like mistletoe therapy, special herbs, hyperthermia, hyperbaric oxygen, red light therapy, all kinds of tools that exist that their ultimate goal is to restore those natural functions and to allow the really sophisticated immune system that works better than any chemotherapy, any immunotherapy, anything that we can create in a lab to restore it to its normal function. And sometimes we get lucky and we can do that. And sometimes we can do it a little bit and it allows us to give us a lot more time. And sometimes we don't get as lucky and it doesn't work as well. But that doesn't mean that those tools don't exist. And it doesn't mean that they shouldn't be used with every single case. Because the big, big, big message that is lost and missed in conventional cancer care is that chemo, radiation, immunotherapy, all the surgery, all those tools that we have are completely abandoning the system that got the cancer. They're not doing anything to address how we got there.
Mhm.
And so that's what we use all those other tools for because they work the best for that.
Yeah, and are there ways do you do a lot of chemotherapy?
I do not do any chemotherapy anymore.
Oh,
I
okay,
work with,
okay.
I know it's crazy, but I stopped probably it's probably been almost 10 years ago now.
Wow,
And it's not because I don't think that there's a place for it, and it's not because there's not some patients that need it. It's
yeah,
because I have so many other tools in my toolbox that
yeah.
now that's the toolbox I choose to use. And then when I have a patient that gets chemo, I work with their oncologist who's doing that.
Oh, wow.
Um, so yes, there are a lot of other tools that you can have.
Yeah, I'm
Yeah.
so glad that came up because I was going to ask you at the right moment, like if there was ever going to be a time where you shifted 100% to the holistic side of things. Is I worked with Dr. Judy Jasek. Are you familiar
Yep.
with her? I
Yep.
worked with her with my cancer guys, and obviously I let fear win with my hemangiosarcoma boy. As soon as we found out on the ultrasound there was a mass, I was like, "Oh my god, yep, let's do the splenectomy," and he plummeted really fast, and, it was so many regrets around that situation, but she helped me a lot with our dog, Anne. We did mistletoe therapy, we did Chinese herbs, we did ozone. I bought a generator and did it at home every day, did all of the things, so I'm happy to see I guess as you get more comfortable and you have more of your own personal data, you're
Yeah.
like, I know how to do this. I know what I'm doing. This stuff works. I don't need this anymore. So I think that's a beautiful thing. But you're right. There are, I guess, what situations would chemo be necessary? Is that a lot of lymphoma cases where it responds well and
Yeah.
younger dogs?
Yeah. The way to think about our conventional cancer treatments and our non-traditional and our integrative cancer treatments are that our conventional treatments win the short game. They're fast acting, they get in, they get out, they do the job really quickly, but they fail over time. Our integrative treatments are more slow, they're more gentle, they take longer to get going, but then they build on one another and they carry us long term. So, this is where they can work really well as a team, right? Because we have our conventional tools coming in really early, really hot, working really good, but then it's kind of petering off over time. Whereas our integrative therapies are kind of taking a while to get going, but then they are becoming really stronger later on. So, situations where patients are really sick, where they have really aggressive, acting cancers, like you mentioned, lymphoma, um, cases where pets are really symptomatic and not feeling well, cases where we don't have a lot of time. Those are all situations where reaching for conventional tools are probably really, really necessary. But when we are in a situation where maybe it's a slowly acting cancer. It was caught really early. It's been there a long time. Those are all situations where time is on our side, right? And we can decide on a case by case basis what is the best tool to use. And, it doesn't have to limit any of them. It's just a big, huge toolbox, and they all can live in there. But we can decide which ones are the best based on kind of everything that's going on.
Yeah, I love it. Getting back to prevention, obviously, we want to get as many things right as we can with the diet, minimizing the toxin load, minimizing stress. What does a ideal protection plan look like? Like, when do you
Yeah.
recommend that people start taking a look at things regularly, diagnostics wise?
Yeah. And that's exactly, I think, the part where owners can, what I would say, be a blind spot is that you can think that you are feeding a really good diet, and you probably are, and you are doing the best that you can to identify all the toxins in your environment. And you are being really mindful about your conventional veterinary decisions, right? About mindful vaccination, mindful spay neuter, mindful ectoparasite control. You can be doing all those things and thinking that you have this really beautiful plan together, which you probably do. And then if something happens like a chronic disease diagnosis, bad blood work, or even, God forbid, a cancer diagnosis, you can feel really frustrated and really blindsided, and like all of your efforts were for nothing. And I've seen this happen over and over. I have a lot of pet parents in my community where this has happened to them. And it can feel like, how did this happen after all of the work that I did? Well, this is how it happens, because the body is a very complicated, sophisticated thing. And every individual interacts with this environment differently. And unless we're doing diagnostics, like you're saying, that can check to see if what we think we're doing is actually happening within the body, we could be completely wrong. So let me give you an example. You could be feeding this beautiful, minimally processed raw diet that, when we look at the analysis, should have plenty of vitamin D. It's got all this organ meat in it. You got all this cod liver oil. Like, there is no reason that I should be low in vitamin D. But then you run your pet's vitamin D level and it is in the toilet. And you're like, how did that happen? Like, I'm feeding enough vitamin D. Well, there's a ton of reasons that that could happen. One is that your pet could have some issues with their gut that maybe you don't realize and they're not absorbing the vitamin D. They could have a genetic mutation that makes it difficult for them to absorb the vitamin D and maybe they need higher levels. They could be having trouble absorbing their food for maybe various reasons. So, layering in these diagnostics that need to either be done with a trained functional integrative veterinarian or through some of the companies that allow you to do it direct to consumer, doing these tests and starting to build a schedule where once a year, once every 2 years, if they're young, you're doing all of them to try to identify what's happening is really important. The other example that I will give that happens all the time is that owners can be filtering water, they can be feeding great food, they can be never walking their pet on grass, they could be living out in the country, and then they test them for glyphosate, which is Roundup, which is a pesticide, and they have sky high levels. How is that possible? Well, let me tell you. The glyphosate is everywhere. Everywhere. And over and over again, I find with my clients that they're being exposed and their pets are being exposed even if they don't think they are. And so the diagnostics, in my opinion, are the biggest blind spot that owners have because they can be putting together a really beautiful protocol, but unless we're testing to see if what they're doing is actually doing having the effect that they want, we can be missing things that are contributing to disease and risk and they don't even realize it.
Yeah, so what are some of the tests that you recommend? I know
Yeah.
there was one that and this is, the Oncotect cancer screening, that's something that I was gonna start maybe when my guy is 4 or 5 years old annually, but what other tests do you recommend for every
Yeah,
2 years for the younger dogs every year as they get past that middle age?
exactly.
Yeah.
So, the easiest ones to start with are your nutrients to make sure that they have the nutrition and they're absorbing the nutrition that we think they are. So, things like vitamin D, vitamin B, things like magnesium, fatty acids, those are really easy ones to start with just to be like, hey, I'm feeding this really great diet. Are they getting all of the nutrition that I think that they're getting? So, that's something really simple to start with. After we do that, then we want to say, okay, is there any inflammation in their body? Because that's usually the first thing that starts to happen when chronic disease or cancer start. All chronic disease and cancer is basically the combination of oxidative stress and inflammation. They always have to be there. So then let's check for inflammation. So we can do that with things like it's called C reactive protein, another marker called haptoglobin. We can also use another marker called proBNP, which is specific for the cardiovascular system. So then we say, okay, nutrition's taken care of, inflammation's taken care of. The next thing, and in my opinion, the most important thing is gut health. So, what is going on in the gut? Because there are so many things in our environment, in our pet's environment, that can disrupt this, that then allow leaky gut, allergies, diarrhea, cancer, everything else to happen. And so, checking the gut for what's called biomarkers, whether they are looking for gluten sensitivities, autoimmunity, detoxification. Basically, there are markers in the stool that can give us clues about systemic health. And then something called the microbiome. Is the microbiome balanced? Is it happy? Does it have the right amount of good guys and bad guys? Does it like the food that you're feeding your pet? Because you could be feeding something that's not agreeing with them and not realizing it, right? Because they can't say, hey, mom, like my belly hurts a little bit every time you feed me that food. They just like go and do their thing. So, gut health is what I would say the third really important one. And then the fourth being toxins. So, checking for pesticides, checking for mold, and checking for heavy metals. Because even when we don't think that our pets are exposed to them, not only are they still getting exposed to them on a day to day basis just because of the amount that it's in our environment, they could also have been exposed in utero and not able to clear it.
Wow. Yeah, that's very important to understand. And I'm glad you reframed it that way because that's a comment or a message I get often is I did everything right. I did minimal vaccines. I just did the puppy vaccines. I fed raw. I did this and my dog still got cancer. And I'm like, stop discouraging everyone. It's
Yeah.
so much more
And
nuanced than that. There's so
it's
much
so much
nuance.
more nuance than that, and
Yeah.
I have yet to meet a single person who has said that to me, that if we dove deeper and we did these tests that we didn't find something. It
Right, right.
doesn't come out of nowhere.
Exactly.
Cancer does not grow in healthy soil, period. It's impossible. So if it
Exactly.
happened, it doesn't mean that you weren't doing everything, you probably were. It means there were blind spots you didn't even know exist that you missed.
Yeah, absolutely. There's just
Mhm,
too many things that we can't control. And then, yeah, you do those tests and you realize there's heavy metals and glyphosate exposure. It's like, what do you do? Do you move? And it's like, well,
mhm.
no, but you can help support the body through that, more liver
Exactly.
support. Yeah.
And being
Uh,
aware of it, right? Because an
yeah.
owner is going to completely have a different experience. And this is what happens to my clients all the time. They'll say, do I really need to test for that? And I'll say, you do at least once so that we can get a baseline, so that we know if it's okay or not. And then when it comes back positive, they say, I just don't understand. How is that possible? But then you dig deeper and you dig deeper and you look into the history, you look into the environment, you ask
Yeah.
questions about the water, you ask questions about the filters, and you start to uncover these clues that there are these holes that
Yeah.
we aren't educated to know about that exist that expose us and our pets to these opportunities for
Yeah.
toxicity, you know, inflammation, and all of those other things.
Yeah. And then something like water's is daily exposure, is getting exposed multiple times every day. So that accumulates really quickly. Yeah,
Totally.
that's so important to understand. I'm so glad you framed it that way. Where do you see veterinary cancer care heading in the
Mm,
next 10 to 20 years? I guess what you would prefer, where do
yeah.
you actually see it heading based on the trends?
Yeah, and I do, and whether this is just optimism or whether this is just because I'm stubborn and I'm like willing it to be that way, I do
Yeah,
think where I'd like to see it to go and where it's going to go are the same place. And I think that what evidence we have of that is the feeding industry. How much fresh food has taken off shows that pet parents are awake. And just even accounts like yours and how many people are interested in what you're saying, people understand that the choices that they make affect their pet's health, and they understand the common sense stuff like, why am I supposed to be eating fruits and vegetables but I should be feeding them crunchies from a bag every day? They understand that that doesn't make any sense, and that there is a gap of information there that they want to know more about. And so where I see veterinary medicine going is very similar to what pet owners are looking for, right? Because they're going to demand it. They're going to ask more questions, and frankly, they're going to put their money there. And so that's where the industry will follow, right? If pet owners want to feed fresh food, if they want to do these type of diagnostics, if they want ovary sparing spays and vasectomies, if they want different vaccine protocols and to do titers instead of vaccines, we will eventually adapt because that's where the consumer wants to put their money. And so I do think that it will start to go to a place of a bit more mindful, holistic, meaning the whole body, understanding of health, right? And it's already happening on the human side with so much of functional medicine, personalized medicine, precision medicine, understanding that these systems are very individualized and very complicated, and that in order for us to develop true health plans, they all have to be personalized. And
yeah,
so that's going to be with biomarkers. That's going to be with specialized blood work. That's going to be, with the advent of AI and all of this, getting really cool, sophisticated plans that are
yeah,
individualized for all of us. And I don't think although it sounds a little like Jetsons futuristic, I don't think that it's that far off because I know that my colleagues get frustrated by treating the same things over and over again and never fixing it. And, when we talk about conventional vets and, oh, they didn't offer this, they didn't offer that. I love my colleagues. That I am not a conventional vet basher. I'm one of them. I spent so much of my life wanting nothing but to be a veterinarian. And so it's not about that. It's just about the model and the paradigm that we're taught missed what to do to prevent the disease in the first place and missed what to do to prevent it from coming back. And so I know my colleagues are getting just as frustrated about seeing you in there all the time for the ear infection. They hate it
Yeah.
too. And so eventually there will be a shift to say, I want to do something different to actually prevent this from happening, not just having you come back over and over.
Yeah, I run into this all the time, and how I see it is conventional veterinary medicine is designed to deliver a standard of care. Unfortunately, so many people, so many pet parents kind of demand that convenience and that quickness and that
Absolutely.
immediate symptom relief. I would say the majority of pet parents do. A lot of them will hear how to do things holistically, and it just sounds like too much work. So, I don't like to bash them. I know they're stuck in this model. They were taught a certain way, but there's a need for that type of care because there's so many dog parents that demand it, and that's the
Totally.
unfortunate side of things.
It's going to take a paradigm shift that I think
Yeah.
is inevitable because so many of us ourselves, as the pet owners, are especially, I was speaking about this shift in younger and younger cancer diagnoses. Toxic loads are becoming higher and higher and younger people. And so as the pet owners are getting older and older, we are all experiencing our own health crises, right? From these toxic exposures, fatigue, hormonal issues, infertility, neurologic conditions, cancer diagnoses, and we are all having an awakening because of that. And so that will translate to say, okay, instead of me being okay with just going back to the vet over and over again to have the ear infection treated, I want to do something about it now because I understand that there's a problem that this keeps happening. And so there will need to be a paradigm shift in a culture, and not everybody is interested in doing that. But in the people who are, there's going to be more and more opportunity for them to do that.
And that's why I enjoy what I do. I'm like, I know there's so many people who think I'm insane and don't wanna put forth that effort, and they trust in the old system,
Yep.
that's how they do things, but we do reach the ones who are willing to hear it, and losing my dogs and feeling so betrayed because I thought I was doing everything right, I'm like, I would have killed for someone to tell me that there were different options, I would have done it in a heartbeat. On that note, on the paradigm shift, tell before we wrap up, tell this audience of mine how I know you have, is it a course, a membership, and can
Yeah.
veterinarians partake in this too? Or are you approved for what is your continuing education race
We have
credits?
race. We're not currently approved
Yeah.
for race, but that's definitely a goal one day.
Oh,
So
you will
current
be. That would
right
be amazing. It's gonna be needed. It's
so
needed. Yeah.
currently right now there are 2 different programs. I have one for my veterinarians and one for the pet parents. The veterinarians, I teach how to do an integrative approach to cancer care so that we can expand that toolbox, right? So just like what you said, when a patient is diagnosed with cancer, what are all those other tools that we can have in that toolbox to make that quality of life, that quantity of life, all of those things improved. For the pet owners, although, yes, of course, those tools are important too, but what I want you to know is let's not ever get in my office in the first place. Let's figure out how to prevent cancer from the beginning and what are those diagnostics and what are those risk factors that your pet specifically has in their home, in their environment that we need to be testing for. And so I have a pet cancer prevention course for my pet owners and an integrative cancer care course for my vets. And so you can learn more about those on my website at drkendrapope.com. You can follow along at social. And I also have a free masterclass for my pet owners, and I'll make sure to share that information for you to learn a little bit more about how to assess for those risk factors in your pet. And so, also, if you're a vet and you just want to dabble in it, you can feel free to do that also. So, yeah.
Oh, I love that this is available. There's actually, clients of mine, friends of mine that have all gone through your course and love it.
Oh,
So anyone
great. Awesome.
yeah, anyone listening, I need to get through it at some point when I can find the time. I'm like,
Yes.
I wanna do all the things. I wanna learn
Yes.
everything. I can't pick a lane.
Yeah,
So,
that's all right. That's I think that
yeah.
happens to most of us when we're passionate and we wanna share information with people. We always wanna feel like we have all of the knowledge to share, so
Yes, yes, exactly.
Yep.
Well, is there any other last thing you wanna add? One last piece of wisdom?
Yeah.
Pressure.
I I always feel like I end with sharing with communities and friends that cancer is such a negative, energy. It's a negative word. Everybody hates to hear it. It's this big, scary thing. Like you mentioned, people like to stick their head in the sand, throw their hands up and be like, I don't want to even talk about that. But it's really can be a very powerful teacher, right? It's just an alarm signal going off in your body and your pet's body. It's just saying, hey, I've been trying to tell you for quite some time that something's wrong, but you're really not listening. So I have to get louder and louder and louder until you pay attention to me. And so it is this really beautiful teacher that can just help you to heal something for you, something for your pet that has been wrong for quite a while now that's just gone undetected. Not because you're bad, not because you don't love your pet, but just because life is crazy and also you're not taught how to hear it, right? And so I would just love if you take away anything from listening for today, that it doesn't need to be this big scary thing that you put in the closet and close the door. Open the curtain, let in the light, and just let it be there and take control of it because you have the most control today. Today, when nothing's wrong, that's when you want to start doing something. You don't want to do it 5, 10 years from now when you're sitting in the doctor's office wondering how it happened. Start today because now is when you have the most power.
That is perfect, beautiful advice. I just adore you. I love your passion. It just shines through you. And I thank you so much for your time. I know you're so busy bettering dogs' lives and pets' lives. So I appreciate you being here.
I'm so
And
happy to be here. Thank you for having me and for letting me meet with all of your audience and hear my story and sharing it with them so I can reach more of them too.
yeah, and we'll coordinate to get some links for the show notes to all of the wonderful things you have to offer. But
Perfect.
thanks you guys for listening and we'll see you next time. Love your dogs.